This video is the first of a series for our patient John, who presents today with multiple exostosis with osteochondroma, which has resulted in tendonitis of his hand, which has led him to an A1 pulley release surgery at his index finger. This is very intricate surgery. There's a small incision which is barely visible, but I can definitely feel it. You can see how the tissue is very blocking his movement. As I pull the index finger back into the extension, you can see the blanching right through here, and the scar is actually right above, right in the red. So you can see, as I pull back, you can see the pull of the tissue even back through that crease in his hand. You can see it pull. There we go. You see it, how the crease pulls back and his finger doesn't go anywhere, okay, which really limits both his extension and his flexion with his functional activity. So I want to show how that scar is really preventing John from opening up the fingers in extension. And there's the flexion. That's it. For his MCP flexion, very limited. So let's compare his right hand to his left hand. Open the fingers up, and you can see the difference in just how the fingers can expand. Now, I'm going to take his index finger on his operative hand and pull it back. And that's it for John. What do you feel, John?
Tight.
Tight. If I go much further, it's going to cause him discomfort, pain. So we want to compare how the other hand is. This is his left non-operative hand. And there we go. See the difference? That is quite a difference in passive mobility. Now, I want to compare the two for flexion as well. And let's make a fist. Open the thumb up. Do like that. There we go. So you can see how the finger can only flex so far. Any pain?
Tight.
Just tight. Okay.
Can't move it.
Okay. Now let's compare it to the left hand. Make a fist with the thumb up. There we go. So really close it up. Good. Open. Close. Good. Open. Close. Now do the same thing here. Open. Close. Open. Big difference. And also noted a lot of swelling right above the scar, probably pocketing in the tissue layers, which is probably also limiting his motion. Because the scar, which is right through here, is preventing and reducing, good proliferation of circulation and carrying away. So it's slowing down the healing process. So we're going to take our measurements. Now this is such a small scar. I'm going to use 1 point of measurement. So I'm just going to put a nice little dot right there. And that is going to be my reference point for measuring the mobility for this particular scar. I'm going to use Goni. Using our directions, superior, inferior, medial, lateral, and then our lift. So we're going to measure superior first. So I'm going to put at about the 4 centimeter. That's going to be our midpoint. And I'm going to pull it superiorly. 1 millimeter, basically. I'm going to pull it inferiorly. Yeah, you can see the thing is just not moving. This thing does not move. Now we're going to do lateral. I would say 2 millimeters laterally. And let's go medially. I would say 2 again. So 2 millimeters medial lateral and pretty much 0 to 1 millimeter superior inferior. Now let's take a look at the lifting. Lifting is critical. And this is where the PT straps can pull it into the Z plane, because we just measured X plane, Y plane, now the Z plane. I'm going to try to pinch this, okay? Here we go. This, my friends, is what I would call a 1 out of 3 grade for lifting. I'm pinching it up. You can see the blanching around the black point. There is no lift of the tissue. So we know there is a considerable amount. If you can look how even the depression and the tethering down, that part doesn't even lift. It's caved in So we can see, I can even draw the area that is not lifting. That entire section is not lifting at all. When I put any pressure on it, you can see it dimples, and it's a good section. It's about a half a centimeter in width of tethering down. Now, let's compare it to the left hand. Same area. We can lift that up. See how I pinch the tissue? How it pinches and comes right on up? Easy breezy, no problem whatsoever. Okay? So that is what we want to get this hand to match the left hand. We're going to take the PT strap. All right? Now, since this is a difficult place to position, you got to kind of use your best judgment. So when we apply the PT straps, I'm going to tear the back of the paper. I'm going to expose one end of the adhesive. Now here at the beginning, I'm going to put it on either side of our landmark. So I'm going to start more of a medial lateral. So open this thing up as much as you can, John. And I'm going to place it down right there. Okay, so I'm putting it down. I'm really going to rub down the adhesive side to make sure we make really good contact. Now, prior to this, we've already cleaned John's hand. Alcohol wiped it all down. So you don't want to forget that step. And this is his initial application. So we're going to separate the two ends. So there's going to be a good centimeter, half a centimeter distance between the two flat ends of the PT strap. So next, I'm going to put this down right along. Open that hand up, up, up. So I want him to really expand the tissue. And I'm going to put it all down. So it is grabbing as much surface area as possible so that when John is applying the mobilization forces through the day, it's grabbing and pulling in multiple directions. So now that leaves us with our little PT strap hoop. But you can see we have a nice space between because John's surgery was mid-October. It's been approximately 5 weeks. So that's kind of where we're at in the time frame. It's all healed up. So 5 weeks, we're always looking at between 4 to 6 weeks usually. There's no scabbing or anything. So he's all good to go. This all looks great. So now we're going to teach the patient how to mobilize, okay? You're going to grab the base of it, okay? You don't ever want to grab the top of it like this because it'll peel off a little bit. So you want to grab the base, okay? And I'm going to do clockwise circles, just like so. Now, you're going to feel it, but I don't want his pain, okay? You feel it, right?
Yes.
You feel it. I'm just mobilizing. I'm going to do 10 to 15 clockwise circles, and it's all within his comfort. That's what's important. Now I'm going to do 10 to 15 counterclockwise, just like so, within pain-free limits. He feels the pull. Do you feel the pull?
I feel the pull.
He feels it, okay? Now I'm going to do my inferior, superior. There we go. He feels that.
Yeah.
Remember how limited the inferior and superior was? So he really feels this. So I am not putting much effort into this at all. Okay? I'll do 10 to 15 of that. Now we're going to go medial lateral. Medial lateral. You feel that?
Mm-hmm. Yes.
Doing 10 to 15 of those. And we're going to do our lifting, which is really necessary here for John. I'm going to pull it up and release. And pinch it up. And again, I'm barely lifting it up, and he feels it. Mm-hmm. Okay, so this is applying a low-grade mobilization to the scarring and the surrounding area. And it's okay. You may see the middle of the PT straps may lift up a little bit. That's fine. That is fine. Because it is so stuck down. He needs that so bad. So I'll do 10 to 15 lifts. And if you pull so hard to where it pops off, you're pulling too hard. Okay? Or if it causes too much pain, you're pulling too hard. And those are the instructions I give the patients. So this is something that is pain-free. They feel it. they can do this off and on multiple times in a day, okay? Which by the time he comes back around to the clinic, this thing will be moving better without me even touching it. So that little sequence, which took a minute and a half, and once John gets comfortable with it, he can do this watching TV. You can do this, and it takes no time at all, multiple times through the day, not tearing, not pulling, not doing too much excessive things with this. So it's really going to promote the release of the scar, because right now that scar tissue is really, it's in the beginning of the remodeling phase. So it responds to even this little bit of stimulus, and any patient can do this. Now, at the end of the day, John, we want to remove it, because I recommend at the end of each day, they put it on in the morning, and then he can apply the mobilization series 5 to 10 times in a day. And then at the end of the day, he's going to remove it. I recommend, you cut the hoop. That makes it easier to peel it off, because we want to peel this thing off. So when I peel, you want to take the little tab, place it close to the body, and I'm just going to peel it right off. Very easy, right? You didn't feel that, right?
Mm-mm.
Good.
Not at all.
Off just like so. Good. Just like that. Simple, easy. I have them take it off at night, so they go to sleep. They sleep without the adhesive on, so we can reduce the potential of skin irritation. Okay, so we just did that one time, right? So, feel a pull?
Not yet.
Not yet? Tell me when you do.
Now.
There we go. One use of the PT straps, and we already see a visible improvement in his passive index finger extension. How's it feel? Feel okay?
Yeah, it feels
Is it
good.
throbbing, anything like that?
Not at all.
Great. So this is the first of many videos with John, and I look forward to seeing his progress.